Good morning, everyone, and welcome to our e-learning series with Henrico Federal Credit Union. Today, we are joined by myself, Crystal Varner Parker, the Financial Education and Community Outreach Ambassador, and I'm also joined by Rachel Lawson and Tina Thomas from the Alzheimer's Foundation Association. We are so grateful to have them joining us today, and we are grateful for each of you joining in for this learning opportunity. Tina, thank you so much for joining us today and to share your expertise to help us all be informed about understanding Alzheimer's and dementia. I'm going to turn it over to you so that you can help enlighten us today.
Perfect. Thank you so much, Crystal. And we're so thrilled to be back again with Henrico Federal Credit Union members and staff. We came pre-COVID and had a great opportunity to share in person. And so we thank you so very much for the opportunity to come back again. Now, I'm going to get my slides together and pull up the slide so that we can all see the same thing. And let's go ahead and get started with our presentation. During today's session, we're going to talk about Alzheimer's disease and dementia. We're going to understand better the difference between the two, how to recognize Alzheimer's and what it's doing in the brain. We're going to take a look at some of the risk factors, the all-important 10 warning signs. We're going to be able to talk about some community-based resources and things that are available for you as well. And most importantly, we're going to make sure that we leave enough time to respond to any questions or concerns that you have. Now, I want to preface this by saying today is about you. I want to make sure we have time to address those things that are very, very important to you. So feel free to put that information in the chat box and we'll respond to it. Some of you may not want to put your questions in the chat box. Then you can say, I would like you to follow up with me later. I'll make sure that you have my contact information and my colleague Rachel's contact information, and we'll be sure to connect with you after this presentation. Now, let's start by taking a look at the impact of Alzheimer's disease and dementia. Now, I'm going to be asking you a few questions along the journey so that we can have the conversation together. Let's test our knowledge. What do we know about Alzheimer's disease and dementia? Now, approximately how many Americans do you think are currently living with Alzheimer's disease? There are more than 6 million Americans that are living with this disease and more than 44 million around the globe. This disease is impacting a significant amount of people. Now, this 6 million is folks over the age of 65. There's a significant amount of people that are under the age of 65 that are also not represented in that number. Now, when Alzheimer's happens to someone, it doesn't just happen to the person, caregivers are impacted as well. How many family caregivers do you think are impacted by this? There are over 11 million Americans that are considered unpaid caregivers for a person living with Alzheimer's disease and other dementias. Women are disproportionately impacted by this, and many of these caregivers are providing more than 40 hours a week of unpaid care. Many of these folks are working in their jobs and then they go home and they have to work again. So this is a very, very taxing disease for the person as well as the caregiver. Let's take a look at some of the facts associated with this disorder. Every time I see those staggering numbers, I am in shock. African Americans are disproportionately impacted by this disease. So are Latinas, Asian Americans, and Pacific Islanders, as well as women are significantly impacted by Alzheimer's disease and dementias. Let's take a look again at more things that we can do to test our knowledge as it relates to this disorder. True or false? Alzheimer's is a normal part of the aging process. Let's say true just to see what happens. No, the answer is false. Alzheimer's is a brain disease that causes people to have difficulty in their mood, language, thinking, judgment, and or behaviors. It is not a normal part of the aging process. Now, what about people younger than 65? Can they get Alzheimer's? Absolutely. I just shared that with you. Although it is a disease that disproportionately impacts older adults, people under 65 can develop the disorder as well. It's called younger onset. So it can impact older adults as well. Let's hear from one of the Alzheimer's Association experts on this matter.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
Yes. One of the things Dr. Schneider talks about that's so very important is there are different types of Alzheimer's, different types of dementia. If ever the doctor says to you, we think that it might be Alzheimer's or we think it might be dementia, there are two things that you want to ask right away is, number one, what kind is it? Because they all have signature trademarks, they all present differently. You want to know everything you can about the type of dementia that's impacting yourself or your family member or your loved one. And then you want to know, what are we going to do about it? Very important. What are we going to do about it?
Certainly having the diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
Very, very important. I see in the chat someone put in there, what about Alice? That was a great story. It's called Still Alice. It really starts to portray the impact of Alzheimer's disease on younger folks. So many of you, people in their 40s and 50s and sometimes even in their 30s can develop this disorder. Now, Alzheimer's and dementia, a recap. Dementia in and of itself, it is not the disease, but a disorder. The disorder causes people to have difficulty in their mood, language, thinking, judgment, or behavior. There are over 200 different diseases that can make that happen. So when people start to notice cognitive inconsistencies or some difficulties in their thinking or their processing, it's very, very important to get into the doctor as soon as possible so that they can start to tease out what is making this happen. It is not always dementia or Alzheimer's. There often could be situations where a person is experiencing a medical condition that can be treated and or cured. So getting into the doctor sooner rather than later is most important. Dementia, not a disease, but a disorder. Alzheimer's is the most common disease that causes dementia-related disorders. So often people use the terms interchangeably. Alzheimer's is a type of dementia. There are many dementias. Alzheimer's is one of them. Alzheimer's is not a normal part of the aging process. It is not something that should happen just because we're getting older. However, it is more prevalent in older adults. It is a disease that happens in the brain. It is progressive, meaning it gets worse the longer we have the disorder. It is a brain disorder, nothing that we should be ashamed of, no different than any other disease, but this disease happens in the brain. Let's hear from another expert.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So it's been over 100 years that we've known about the neurofibrillary plaques and tangles that happen in the brain. Those plaques and tangles are the two signature hallmarks for Alzheimer's. Now, you may have heard recently about a new medication that's on the market, the first medication that has been ever developed that could potentially change the course of the progression of the disease. It helps to remove the plaques. That is what that aducanumab does. It helps remove the plaques, not all of the plaques, but some of them, so that a person has more time to function life as normal. So that is on the market now. It has just been had accelerated approval from the FDA. More is going to be known about this over the next couple of months. Alzheimer's causes nerve cells to die, which leads to shrinkage in the brain, which then can result to some of the difficulties that folks are having. It's important for folks to know that, because often people will say, Tina, my mother, she's just always been stubborn, and that's the reason why this is happening. Well, maybe she has always been stubborn, but maybe she's stubborn, but now there's a disease that could be accelerating or exacerbating her stubbornness. So it could be a little bit of personality in there, but there truly is something happening in the brain that is causing this person to respond to and exhibit some of the behaviors that they may be exhibiting. Let's take a look at some of the risk factors associated with the disorder. They're going to ask us to test our knowledge again. So what would you say is the greatest known risk factor for Alzheimer's disease? Age is the greatest risk factor for developing this disorder. Older age, the greatest risk factor. After the age of 65, the risk of Alzheimer's doubles every 5 years. 32% of people aged 85 or older have Alzheimer's disease. It's really significant amongst older adults.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
Very important. Those risk genes, things associated with hypertension, high cholesterol, obesity, those things put you at greater risk. Having a stroke, these things put you at greater risk. It's not an absolute that it will happen. It just puts you at greater risk. Deterministic genes, only about 3% of the people have deterministic genes. So from the book Still Alice, she was a person who had a deterministic gene. And if you have those deterministic genes, the incidence of those is significantly higher for developing the disorder. As I said previously, Hispanics, African Americans, older Hispanics, older African Americans are disproportionately impacted by this disease, and so are women. Not only are women more likely to develop the disorder, they're more likely to be caregivers. Age is the number one risk factor. There is a genetic component, but it's very, very low. Family history can be a factor. Knowing whether our genes are deterministic or not can be a factor. So controlling those things we can control is important. Controlling our blood pressure, hypertension, making sure that we're embracing a Mediterranean diet. All of those things are very, very important. And then knowing that Hispanic and African Americans, women are disproportionately impacted, but women overall are disproportionately impacted by this disorder. Now, you will hear often folks talk about the different stages of the disorder, 3 different stages of Alzheimer's disease. It's different for every family. It looks different from every person's, from house to house. It's just not the same every single place. It's really the experience that's happening in this person's home. So let's take a look at the differences.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel, so I've even stopped trying.
And these are true folks that are living with this disorder.
Math, I can't do a simple tip anymore. I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, as an avid reader, as a reporter, as a writer. I struggle with them now.
Mm-hmm.
I'm like an overachiever and when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
Yeah. Gosh, very powerful.
I think the thing that surprises me the most about my dementia is that it is progressive, and I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor, and So that becomes a little disconcerting at times, to see my cognitive impairment continue to decline. Um, but again, I really have hope. Um, I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
I mean, very, very powerful examples. And these are folks that look like us, sharing their very, very personal experience as it relates to this disease.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is, their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
Very important to know. It's very different, but understanding that that middle stage can last for a very long time. Offering people support can be very important. So there are 3 primary stages. No 2 individuals experience the symptoms the same. And you'll hear that from folks. Well, this is what happened with my mom. You should do this. Well, it may not work for your loved one. So really finding out what works best for your loved one is very important. And really the critical thing here is planning, having conversations and planning for, the future. Even though this person living with the disease says, I can't live for tomorrow, as a care partner, care supporter, or loved one, it's very important to start making plans and preparations so that we can provide the best care possible for those that we are supporting. Let's test our knowledge, what we know about the treatments that are available to help manage the current symptoms associated with the disorder. Current drugs help address symptoms, but do not treat the underlying cause of the disease. True or false? What do you say? True. While these medications do not stop the damage caused by Alzheimer's, they can help lessen the symptoms. So the medications that are on the market, they do not provide a curative mechanism. They just help manage the symptoms associated with the disorder. This can be very, very challenging from families because many times families will say, no, when my loved one started taking that medicine, I saw a significant improvement, but it's really very short term.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time.
They do help for a time. So one of the questions,
So the first
sorry,
class of
Dr.
drugs are
Hendricks.
cholinesterase inhibitors.
Yeah.
These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
Yes. And these medications have been on the market for a number of years. And that's why the aducanumab is the newest medication in over 20 years to help manage not just the symptoms, but the underlying disease cause. And that's very, very important. So one question in the chat box is, can dementia symptoms be different or diagnosed from stroke symptoms? Often when someone has had a stroke, on the other side of a stroke are symptoms related to dementia, difficulty with language, mood, judgment, thinking, behavior. So the impact of the stroke often can cause what's known as vascular dementia. There's been an interruption in the vascular system in the brain, and as a result of that, a person can develop vascular dementia. Very specific symptoms. That's why it's important to understand the type of dementia someone has. Vascular dementia moves in what's called a stepwise fashion, meaning it's a slower progression. People don't just steadily decline. They decline and then they sort of plateau, and they'll be that way for a while, and then they'll decline again. When there is a decline, it's pretty significant. Three types of medications that are on the market. There are 4 now since the aducanumab. Aricept is typically the first line medication that providers will offer to someone. When Aricept is no longer effective, the doctor may offer Exelon, which typically comes in the form of a patch. And then when folks get into the middle stages of the disease, most often the provider might offer Namenda or Nemzaric. Very, very common. Advances in the research. Investigating early interventions, exploring lifestyle factors, moving forward toward a cure, and securing funding. Let's take a look at exploring lifestyle factors. What are those things that we can do to help minimize our risk for developing this disorder?
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past are things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
And that's very, very important. Now, thinking about that, there are 4 things that we can do. Socialization, staying connected to people. Even in a socially distant world, there are ways we can stay socially and emotionally connected. Staying connected, very important. Our diet and nutrition, embracing those, Mediterranean diet, pushing back from some of those high sugary carbs, those type of things. Education, like becoming a lifelong learner, taking a course, what you're doing now that the credit union offers, that is absolutely exceptional. And then being intentional on brain health. And consider exercise that works both the left and the right side of the brain. That left side is our much more analytical side of the brain. The right side is our much more abstract thinking, fun side of the brain. Think of things that you can do that works both sides of the brain. Being mindful, yes. Continuing education, staying connected. Find a way to get some music in there. If you can do something with music and movement and deep breathing at the same time, you're giving your brain a full workout. And then, of course, we're still doing everything we can through research to move towards a cure for this disorder. Many ways that people can get involved. We do the Walk to End Alzheimer's is our largest awareness campaign and our largest fundraiser. The Alzheimer's Association, we raise 100% of our funds, and 80% of every dollar that we raise goes right back into the community. Another great way that folks can get involved is by clinical trials. Boy, have we heard a lot about clinical trials and research here lately with the pandemic and all these other things going on. It's important that we participate in clinical trials, even in times past where things were not always as equitable and they weren't as ethical. It's still important that we participate in clinical trials so that we will be represented in the study. So let's listen to find out a little bit more about clinical trials.
It's more important than ever for people to participate in clinical studies. The fact is, right now, we don't have an effective treatment to stop Alzheimer's disease. And if we don't have people participating in clinical trials, we never will. And so participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
Sometimes you hear the phrase, it's a failed trial. That means that it didn't hit the endpoint, it didn't achieve an FDA-approved drug. But I would say as a scientist, the only failed trial is one that doesn't give you valuable information. And if the trial is well designed, if it is a good scientific experiment, you get extremely valuable data so that you can plan the next trial and do the next study even better than the last one. And it gets you that much closer to that FDA-approved drug, to that effective treatment, and maybe someday even a cure.
Absolutely. Absolutely love that explanation from Dr. Hendricks. And here we have another question in the chat box. What is the average length of the late stage? What's the life expectancy for vascular dementia after a major decline? It really differs from person to person. It's a great conversation to have with your doctor because often people have other medical conditions that play a role in how they progress in this disease process. Many people that are living with Alzheimer's disease or some variation of dementia have other medical conditions. So it's not just Alzheimer's proper, it could be Alzheimer's disease and Parkinson's, or Alzheimer's disease and heart disease or vascular disease. Those other disease or comorbidities could play a role in how the disease is progressing. People in the late stages of the disease process, these are folks who are most often needing 24-hour care. They are often mostly bed or chair bound. These are folks that are not walking. They are speaking less than 7 words. They often can no longer make a smile. Can you connect with them? Absolutely. Absolutely, you can connect with them. It is the most debilitating part of the disease process in the late stages, but these are folks needing a significant amount of care and respond most often from sensories, things they smell, touch, feel, and hear, as opposed to other stages of the disease process. So we can still connect in many, many ways with the individual, but really having a conversation with your doctor if you're starting to notice changes. Even though a person has dementia, and even though they're in the late stages of the disease process, that does not mean that something still can't be cured. If this person got a bad sinus infection or upper respiratory infection, that could impact what their care looks like or how they're responding. They could still get antibiotics, and they can get treated and they'll go back to their normal baseline. So really, really, really being in touch with your healthcare provider is important. People living with dementia, caregivers, and other healthy volunteers with Alzheimer's and dementia are encouraged to participate in clinical trials. They don't just need people who have dementia to participate. We need younger folks, we need healthy folks as well to participate in clinical trials. It's so important. Now, there are also community-based resources and things that we can do to provide support to folks in the community living with this disorder. The Alzheimer's Association has an opportunity to provide support and care across the country. So there are offices and chapters and our 24-hour helpline that can provide support to folks who are impacted by this disease. We have folks that are on the helpline. They can respond to your call anytime, day or night. The other thing that's wonderful is they can translate it in over 200 different languages. The helpline is what I call our pipeline of immediate support to folks in the community.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
Absolutely. And we have community-based resources. Go to alz.org and you'll find all kinds of information about programs, educational opportunities that are going on in your neighborhood and your community. We are back to offering some programs in person, but many of our programs are still virtual. Depending on what happens with this Delta variant, you know, we're grateful that we can still offer programs in a virtual platform. You can always participate in the Alzheimer's Association's Walk to End Alzheimer's. They happen across the country. Our walks to end Alzheimer's are happening right here in the local Richmond area. You can participate in person or you can walk in your neighborhood and your community. Lots of resources to help us fund the fight against Alzheimer's. Now, there are lots of ways people can get involved. We always need volunteers to do programs like I'm offering today. We need volunteers to help us with support groups, people to help answer the phone and just provide a listening ear. Offering support to folks in the community is a significant way to support families. Advocacy, you know, getting on board with our advocacy team, going to see our local legislators, letting them know that this is an important topic and message for us in our community. We want you to vote for funding to come back to our communities. Trial match, also a great way to get involved with clinical trials. The Walk to End Alzheimer's, and then the Longest Day. That's a great way to customize a fundraiser to raise awareness, but also funds to help us fight this disease. If you can spare a few hours, a few moments, or you have some more significant time, you can always reach out to us here locally. There are over 150,000 families that are supporting someone living with Alzheimer's over the age of 65 in our region. Myself and my staff, the youngest person that we're supporting just turned 32. So it is impacting lots of people, and we want to do everything we can to support as many families as we can. Here's our 800 number, again, our ALZ number. Now, I'd love to take any questions that you would have for myself or my colleague, Rachel. I'll take a look at the chat box here as well.
Tina, can you touch on legal assistance and planning for the future?
Sure. One of the biggest gifts you could give to your family is spending some time with an elder law attorney. There are several of them on our website that you can reach out to, and they can give you some guidance. Many will offer an hour or half an hour consultation at no cost. Very important. They can help you figure out how to move money around and what to pay for, and the difference between Medicare and Medicaid, and what Medicaid will pay for and what it won't pay for, how to set up trust. It's very, very critical that you work with an elder law attorney, not just any attorney or not just any financial planner, but one who is certified in supporting older adults in those legal matters. Now, you might say, Tina, I just don't have the resources to pay for that right now. Is there any other supports available? Yes, absolutely. You can reach out to your local area agency on aging. Now, in the Richmond market, that is Senior Connections. Senior Connections has a legal team who can provide you support. And I know that they work with several lawyers, and they have what's called Senior Law Day. And this is where several attorneys, elder care attorneys, they donate their time and provide these resources at no cost. So you can always reach out to Senior Connections right there in the greater Richmond area to find out about legal support. And if all else fails and you says, I just can't remember any of that, Tina, I'm so overwhelmed, call your local 211. 211 is a hidden gem. That's a resource hub for Virginia. It just does not just support Greater Richmond, but all of Virginia. 211, and they can connect you to the resource that you need regarding any services or any questions for older adults. 211. Yes. Any other questions, Rachel?
Type of doctor to obtain an evaluation in local places in the Richmond area.
Yes. So what I will say to you is most often people will go to their primary care provider first, and that is absolutely appropriate. Often the primary care provider might make a recommendation for additional testing. They may send you to a neurologist to get some additional testing, or a psychologist to figure out what is going on. If I, Tina, were going to take my dad in, I would look for a geriatrician, because a geriatrician is a provider who specializes in older adults and conditions that impact older adults. They're not always that easy to find, but a geriatrician is an extremely great resource when you're looking for a provider. Now, in the Richmond market, there are a couple of places that do a great job with diagnosing memory disorders. Now, it's a little bit of a drive, but one place is at UVA. They have what's called the Memory Disorders Clinic. It's the only full-time memory disorder clinic in Virginia. UVA, Dr. Carol Manning and her team are doing an exceptional job. Riverside Center for Excellence in Williamsburg, they also have a part-time memory assessment center. And I have been told that the VA can also do what's called differential diagnostic testing. They can help you figure out which type of dementia does this person have. So the first place you might want to go to is your primary care provider. They're probably going to make a recommendation for you to see a specialist. So this is usually not something that will happen overnight to get to the diagnosis of dementia. But at the memory assessments clinics, they do a great job because they have all of the specialists under one roof. So you can go to one location and you can get your neuropsych testing, you can get your imaging testing, whatever they need to do under one roof, and it's very, very comprehensive.
As far as if you're caring for someone who lives in another state, and you're having a hard time finding resources, there's a local, most likely a local chapter in that state that serves the area that your loved one lives in. So if you reach out to that chapter, you should be able to get the local resources there within that service area that you are looking for. And also the Community Resource Finder is available for you to search according to zip codes.
Yes.
So,
and sometimes in small rural communities, it is challenging. That is absolutely true. But reach out to the local area agency on aging in that community. So you can always, to Rachel's point, reach out to the local Alzheimer's Association that's supporting that area. We do have the resource that Rachel just mentioned. It's called Community Resource Finder. When you go on the Community Resource Finder, it'll ask you some questions. What are you looking for? And then what is the zip code where the service is needed? And it will search for you in a specific radius, 25-mile radius, 50-mile radius. It'll query it for you, and it'll provide you with a list of organizations that can help you with whatever it is you're seeking. Or you can, of course, reach out to the local area on agency or dial 211 for that community that you're seeking support from. All communities have a 211 system. Now, here's another question. Can an auto accident can lead to Alzheimer's disease or dementia or signs of it? So a brain injury can absolutely cause a person to have dementia-related symptoms. Remember, dementia is not the disease, but it's an indicator that there may be a disease. So someone could have a head injury, and as a result of the head injury, exhibit signs of dementia. Absolutely. Very important to have a conversation with the doctor so they can do some testing to figure out what is going on. If you have swelling of the brain, hematoma in the brain, bruising in the brain, those type of things, you will start to notice those difficulties of dementia-related symptoms. Yes, absolutely. That can absolutely happen. And there are a couple of events I want to share with you that are upcoming before we take off. Our annual conference on dementia is coming up. This year, the conference is offered at no cost due to the generosity of our sponsors. This year, the conference will be on September 23rd. We've got some exceptional presenters that are going to be there talking about post-COVID-19 brain health issues. A lot of research about that. Talking about equity and access issues for people who are impacted by Alzheimer's disease and dementia. And then talking about Alzheimer's and dementia, the chicken and the egg. What happens first? Do I get older? Do I have problems? Answering all those wonderful questions. And then we have a great interactive program with about 12 experts from across the Commonwealth that are going to be talking about those things that we want answers to, related to intimacy, driving, how does that impact us? What about drug interactions, oral health, and dementia? We've got legal attorneys that are going to be on board. Wow, it is going to be spectacular. And the sessions is only from 10 to 2. So we'll have a morning session, we'll break for a half an hour lunch, then we'll come back with the afternoon session. So we've got a lot happening in a short amount of time, and that's a great opportunity. Lastly, we have a great program that we're offering for folks that are on a little bit more of the western part of the state, in the Farmville, Buckingham, Amelia, Cumberland area. A great program that we're partnering with Piedmont Senior Resources. We're providing not just education and information to folks in the region, but we are also offering people an opportunity to attend a caregiver retreat. The caregiver retreat is going to be spectacular. We're setting it up to be in person. There's a large venue, and there's going to be a beautiful giveaway for the first 100 people who register and attend this session. They're going to receive a gift card due to the generosity of Piedmont's Senior Resources. There's a gift card and a beautiful giveaway bag of lots of wonderful things that will be given to all the folks who show up to that event in person. Thank you so much for spending your time with us today. I so appreciate it very, very much. I appreciate all of your questions and sharing this moment with us today. I'll turn it back over to you, Crystal.
Thank you so much, Tina, for all of the great information that you shared, all of the questions that you have answered. You have been a wealth of wisdom, and we are so grateful for what you have done for our members and our community. Thank you to all of the participants for being here today and for being so engaged, and for the great questions. So thank you all.
You bet.
Have a great day, everyone.